Welcome to the Pharma Voice Editor's Take video series, filmed live at the 2012 DIA Annual Meeting in Philadelphia. Hosted by Taryn Grome, editor of Pharma Voice. In this session, Taryn meets with Fiona Geiger, Senior Director, Global Project Management, Cenduit.
We're here at the annual DIA conference with Fiona. Thank you so much for joining us.
Thank you.
Talk to us a little bit about what the issues are investigator sites are facing that interactive response technology, or IRT, could potentially alleviate.
Okay. I think, at any investigator site, the number one concern and the number one problem is that there just aren't enough hours in the day. So with our system, the goal is to enable the site to be more efficient, to do things more rapidly, to leverage technology to make it easier for them to do the tasks that they have to in a day. For example, drug accountability, making sure that they can account for that in the system, ease of training, online user guides, having a 24-hour help desk that's available to answer their questions, that's knowledgeable, that can assist them with their day-to-day activities, making sure that we have the right drug at the right place at the right time for the right patient. For clinical sites, that's the most important thing. They want to get into our system and out of it, getting their needs met for the patient who's waiting there on site. So, the resupply of drug, making sure that using the system is easy, it's intuitive, that they don't have to think a whole lot about it. I think, having no experience almost is better than having, some dramatic experience once they log into the system. They just want to be able to do their work efficiently, effectively, and on time for their patients.
So with the rise of clinical trials in Asia, switching topics a little bit, and the advent of biosimilars, how can IRT reduce costs in the clinical supply chain?
Well, kind of touching on the same things that I mentioned before. Biosimilars or any drug product that's been investigated, there are drug products that are very expensive. Comparators are very expensive to procure, to supply. With biosimilars, often comparators are procured at clinical sites. Our system can supply the drug, can make sure that the drug is used most effectively, the quantities that are available, that costs are kept low. We obviously want to use the drug most effectively and have as minimal waste as possible. So using a resupply algorithm in our system that is taking into consideration the enrollment expectations of sites globally, and then using real-time data as enrollment starts at those sites to adjust it. So it has to be an algorithm that is flexible, as well as enabling sites to log in the quantities of comparator drug that perhaps they procure locally, and then to be able to account for that and have accountability in the system so that the sponsors and CROs know exactly how that drug's being used, for which patients, and the quantities that are left and available.
That's terrific. Now, how is the increased uptake of EDC impacting IRT?
So, one thing that we've noticed is that, the majority of clinical sites now obviously have web access easily because they're equipped for EDC. They're also equipped to use the web. We used to see a lot of trials that used the phone in addition to the web interface, but now there's a very small use of the telephone for interactive technology. As well as with EDC, another thing that we want to make sure we're doing for those clinical sites is reducing double entry. Those sites, those personnel, they don't have much time to spend on either of these solutions. So we want to make sure that the data flows seamlessly between one to the other, that double entry is reduced. Our system has a different use to an EDC system, collects different amounts of data. It's a kind of an immediate use for a patient when they show up at the clinical site. So we want to make sure that they can use our system, get into that quickly, enter the minimal amount of data that's necessary to do their job, but then that data flows into the EDC system so that they don't have to enter it again. It also reduces the number of queries down the line because the information, once it flows, then it can be used for edit checks, and if there is a discrepancy, that can be flagged and it can be addressed immediately rather than at the end when you're doing a whole lot of data cleanup.
I want to thank you so much, Fiona, for providing us with your expert insights on the topic of IRT.
Thank you very much for having me.
Additional Editors Take videos, as well as podcasts, white papers, webinars, and more, are available in the resources area at www.pharmavoice.com.